Hello, everyone. It is a joy to be here to present at PHHP Days, such a wonderful celebration of curiosity, innovation, and community. I'm here to talk about something we are all learning how to navigate, digital media and technology, and in particular, how today's digital environment shapes child development. Children are growing up in a world vastly different from even a decade ago. Tablets, phones, video games, social platforms, these aren't just tools, they're spaces where children learn, connect with other people, and explore. And that's double-edged. Technology can be a powerful tool for good, but it also raises questions about attention, emotion, social skills, and well-being. We have to appreciate the scope of influence digital sources can have. Today, internet use is basically ubiquitous amongst youth, with 96% reporting daily internet use and 46% saying they're online almost constantly. Social media and digital entertainment media top the list of kids' engagement, with about half saying they have multiple social media accounts across platforms, and upwards of 73% on YouTube, for example, every day. Now, with the advancement of AI, we also see the majority of teens engaging with AI chatbots, with 28% saying they're using these chatbots every day. To understand child development, most of my work has utilized this socio-ecological model from Urie Bronfenbrenner. This model considers the child at the center, nested within rings of social influence, with more proximal influences like family and peers, having more direct impact on the child, and surrounding rings holding more indirect but also influential impacts. Advances in technology have introduced new influences across every level of this model. For example, most teenagers have some form of personalized media device, like a cell phone or a tablet, that introduces a whole world of information and social contexts. Online video games and educational tools create opportunities for connections across these microsystem levels of influence, like peers and school and family. And social media can cut across all levels of the model, serving as a connection between social contexts and offering a megaphone to influencers, government leaders, and industry to send messages to direct individuals. Lastly, artificial intelligence has potential for influence across the entire system, and likely will change social interaction and connections and the ways that we engage. Also likely to impact how children develop their identities, both online and offline, which may or may not be similar or congruent with one another. Anytime we're confronted with a shift in society this large, such as this digital revolution, we really do have to examine all corners and edges of the potential impacts, particularly for our youth. They often enter into life contexts without ever being asked what they wanted. And with digital innovation, they likely won't ever even understand what life is like without technological integration. This is why we need to identify and weigh the good, the bad, and potential ugly parts of digital integration into life. So, let's start with the good. We know that digital tools can enhance and facilitate learning. Carefully designed educational apps can strengthen literacy, problem solving, and even math foundations when paired with appropriate adult guidance. Technology also holds tremendous promise for social, mental, and behavioral health. It can facilitate connections, particularly when in-person interactions are limited. It can also allow children to explore different aspects of their identity. They can grow creative talents, knowledge, and connections from resources that could be even hundreds of miles away. These connections build support and belonging, critical components of well-being. And within the mental health space where I primarily reside, technology provides a gateway to treatment supports and services. We can extend psychological care through development of tech that promotes wellness, offers home practice for therapeutic activities, and provides prevention and intervention services to populations who lack access to care or have problems that may involve stigma or other treatment barriers. For example, this third image here is a screenshot of Tech Parenting, the web-based digital parenting program I developed, designed for easy, self-paced, at-home use for the very busy lives of parents. Another example of digital innovation for health promotion is a smartphone app we designed to address the problem of underage alcohol use. Most substance use prevention is done through school-based programs, but these can only provide universal content for all users, occur during times when kids are not around alcohol and rely heavily on the knowledge base and interaction style of the person doing the teaching. Mobile Coach Teen was an app that allowed high schoolers to gain access to information about alcohol use that was tailored to their risk level. Low-risk youth received messages around prevention and praise for resistance, while high-risk youth were offered more risk reduction, self-monitoring, and drinking reduction messaging during their identified high-risk times of day. The kids found this approach engaging, useful, and interesting, and this is just one example of how we might innovate within digital spaces to engage youth for health promotion. But it's not all daisies and sunshine, unfortunately. There are real challenges too. Excessive or unstructured screen time has been linked through prior studies with attention difficulties, sleep disruption, and negative mental health outcomes. And digital environments, especially social media, may expose children to unrealistic expectations or harmful content. The rise of youth smartphone access also resulted in early concern for cyberbullying, which is a distinctive form of bullying in that it can follow a child home. It can be either private or public in nature, depending on the context. It can mask the perpetrator's identity, and the content can continue to perpetuate through reposting, sharing, or difficulty in getting the content removed. Importantly, not all technology use and digital engagement is equal. Nature of content, context where it's being used, and adult and peer involvement matter. In fact, one of the strongest links between digital engagement and youth health outcomes is the connection between youth exposure to mature media content, such as substance use marketing, and youth health risk behavior. Which brings us to the ugly of technological innovation and child development. There exist multiple industries that are meant for adult consumption only, but the rise of technology has provided entry for those industries into the hands of children. Some folks have a difficult time accepting the influence media and technology may have on child development and behavior, particularly as it relates to deviance and risk behaviors. But the link between youth exposure to substance marketing and substance use behavior is incredibly well researched and supported, with multiple longitudinal data sets identifying strong and independent associations between youth exposure to tobacco marketing and youth initiation of smoking and progression to regular smoking. This evidence rose to the level of the Surgeon General identifying movie smoking depictions as causal for youth smoking initiation, which is why we see a lot less branded smoking depictions in movies today. The same holds true for alcohol marketing and youth drinking behavior. This finding has been replicated study after study across multiple samples of youth, and even in different countries, with the same significant, consistent, and independent link identified in every study. Findings are now extending to other substances and other health risk behaviors, including youth exposure across platforms like social media apps and digital streaming apps. We were interested in following up on this connection, so we asked high school age youth to upload any images that they had come across of alcohol depicted in their social media or online engagement for about 9 weeks of data collection. We were shocked at how many uploads they provided, which is likely an underestimation of their true exposures because of the effort it was involved in uploading the images. Over 8,000 different exposures were reported over just across 2 months of participation. They included influencer posts, alcohol advertisements, posts from peers and family members, all different kinds of sources. Posts were overwhelmingly positive in their depictions of alcohol and drinking. We need to be aware that this is the digital age of teen socialization. So in this context, we might find ourselves asking the question, what can we possibly do to keep our children safe and healthy? It feels kind of overwhelming. But thankfully, good news, this is a public health talk, so I came with recommendations. We'll start with parents. So parents can educate themselves on what risks exist within which digital context to promote health and safety for their children. This is a bit of a task because digital contexts are evolving every day, and along with them, associated risks. So we really have to stay up to speed. We also need to be present in the spaces where our children are, including the digital spaces. Follow them on social media. Join the online groups that they care about. Lots of ways to get engaged online in the same way that parents would engage in the built world. Relatedly, the good news about digital parenting is that it can be remarkably similar to built world parenting, and most of the general good parenting skills apply. Parental warmth and openness foster good communication and support parental monitoring. Having good communication allows appropriate and effective expectations and rule setting. And all of these things help promote child wellness. For our policymakers and funders, we are in a critical time when policy decisions around technology and its impact on kids will likely have massive impact. It's important that these decisions be as evidence-informed by the science as possible. That said, this is still a relatively new research area, so we need to continue to invest in understanding the impacts of technology on child health within a developmental frame. If possible, we really should work to look ahead to potential future risks and invest in and prioritize prevention efforts that can undermine that risk. An ounce of prevention is worth a pound of cure, and it's often much more difficult to pull back on things that have already been implemented and disseminated widely. An early, easy focus here would be around industries that can impact child health risk. Lastly, for my people, researchers and educators, we should be pressing on the more complex and difficult questions, rather than the simple ones. Much of the research on technology usage has focused on measurement of simple constructs like, how much time do you spend online, rather than the features of engagement that we already know matter, things like exposure to mature media content and digital risk behavior engagement. We should be focusing on research that targets high-risk youth behavior so we can minimize their risks and promote their wellness. And we should continue to press innovation within our academic spaces so we can stay at the forefront of the conversation about technology and child health and ensure the public is being offered solid, evidence-based recommendations on what is best. Lastly, innovation is naturally going to involve some risks on the way to success. We have to be willing to look at those potential risks, examine them, work to prevent them, but forge ahead bravely to promote child health in this digital era. Thank you so much for your time and attention. I obviously care so much about this topic as I try my best to navigate this world with my own 13-year-old daughter. I hope we can achieve more together around this very important issue.